Are you still relying on traditional patient portals while your competitors from other healthcare systems are racing ahead in the more innovative way to bring the patient, the caregivers, and the clinicians all on the same page? Today, we're going to explore with two solutions that has been the forefront of driving these changes on how have they come up with the integrated way to provide better patient engagement, caregiver support, and allowing clinicians to know their patient's progress a lot more ahead of time instead of being an aftermath. These insights can position your healthcare system to be the forefront and the leading in medicine compared to other healthcare organizations. Stay tuned.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. In the next few episodes, we will have a mini-series from a series of interviews that we have conducted during Vive 2024 in Las Vegas earlier this year, where we interviewed many different solutions that are both from the device, wearable industry, digital health, or interoperability. And each mini episode will bring you two experts in the domain and share their insight of what solution they have brought to the forefront of healthcare innovation. Now, today's episode, we're featuring Tiffany Stapleton, the Vice President of Marketing at Celebrex, as well as Jill Michael, the co-founder and CEO of Keith & Kin. Tiffany has been recognized as the marketing leader in the healthcare arena, bringing brand innovation at Celebrex. With extensive experience in creating B2C and B2B marketplace, digital advertising, experimental marketing, and public relations. Let's hear what she has to say.
Hi, this is Sabrina Runbeck. We are at Vive with Tiffany Staples from Celebrex, and we're so fortunate to be able to talk to so many founders in this space to help us to really understand how we are shaping the healthcare system. So tell us more about your company. What's the really true mission behind it, and how are you uniquely solving a problem in the space right now?
Sure. So I'm our VP of Marketing, and our mission is really to help connect the providers and also the patients together. So we are really trying to include a very inclusive experience by giving digital data to the provider in order to make sure that they can combine inpatient experiences alongside a patient journey on a website or an app.
When you're thinking about the patient data and connectivity, elaborate more on that. How is that truly helping the patient experience?
It's really providing an opportunity for the provider to give more information to the patient. So whether they need information on a new diagnosis of maybe type 2 diabetes, or they are looking for opportunities to get healthier, knowing what they do on a digital platform and being able to connect that across the institution. So maybe on like a MyChart or an Epic, with that data, being able to connect it, they can actually personalize the journey and make it so much more authentic for the patient and give them that information that they need in order to improve their health.
Right. Now it's all about precision and personalized medicine, not just doing everything as a whole umbrella. Because in medicine, a lot of time we say, oh, there's a big study, this is how we do it. But everyone is very different in their needs, wants, and wishes, plus their own medical profile. So appreciate you guys are on this journey to bridge and tailor the experience for our patients and then all the caregivers that's involved with that journey. How have you guys been going to market to truly stand out and get the resource to the right people?
So we have 3 large healthcare clients within the U.S. And as we go to market, we're really just trying to tell our story and trying to help providers understand the benefit of connecting that data across these systems and across different engagement touch points with patients. So it's selling the benefit and really helping people to understand that benefit is most important for us.
For sure. In most of the time, when you have a new technology coming in, it's all about education. It's how is this actually going to help you versus this other things that are hoping to create the same goal. So now if I'm going to give you a magic wand, a big thing will just disappear. What is that one thing you truly needed to move out of the way so you guys can continuously to grow?
I think one of the largest things would be reliance on old systems. Old systems really kind of pull you back. They don't provide that opportunity for the innovation that's really needed to help connect these experiences together. How amazing would it be if you went into your provider's office and they understood maybe what you were asking for? Because for most providers, what we've heard is that they're having these interactions with their patients and they go to leave the room and there's always like, oh, but wait. So if you already knew what that oh, but wait was before your patient got in the room, you would be able to provide much better care and really take care of their needs greater. So kind of removing that reliance on those legacy tech and bolstering that with something like our technology would really encourage that sort of behavior.
Amazing. It's really proactive capturing the information and giving both the clinician a whole picture. So we're not relying on patients or caregiver to remember everything because they're busy, they have their life, they already have to deal with their illnesses. Now, we all love conferences. That's why we're at Vive.
Yes.
And what made you choose to come here this time? And what are you really hoping to get out of it?
Well, Vive is an opportunity for us just to really help get our mission out there and to help show people what it is that we can do and that we can provide them with that opportunity to just increase their patient connections. So we're hoping just to get the word out and raise awareness for the product and hopefully really change the way that patients and providers interact.
Amazing. I so appreciate you for being here and enjoy Vive.
Absolutely. Thank you so much.
Hey there, Visionaries! What did you think about the conversation that I had with Tiffany? We're no longer just slapping a old system together. We're actually, for Tiffany's, Celebrex is changing the way that we see how when people go to online search for their problems, challenges, and immediately actually get connected to a solution, and somehow, magically, the clinicians, when they are connected, also have a plan already created. That is the power of technology. So, what did you think about the solution that was shared earlier? Have you already experienced something similar or different perspective? We definitely want to hear from you and comment below. And if you haven't subscribed to our show, please do so. Now, it's almost like their solution is reading your mind. Now we're stepping into our second speaker because we are in the era of not just reactive medicine, but truly being in responding proactive way of addressing our concerns from a clinician perspective. We're healthcare advocates as well as immersing in the space to actually support patients, but it's not just patients, but also the caregivers behind each patient to create those personalized care. So if you're listening and thinking, oh yes, I do have a story to share myself, then we encourage you to apply to one of our speakers to see how we can also give you the right spotlight in the space. Go to theprovidersedge.com to apply, and then we'll look forward to having you. Our next speaker is Jo Michael. She has created a platform called Keith and Ken, which serves a digital management solution for caregivers to share health information across their families related to these specific patients that they are taking care of as a passionate advocate for human and at the center of every single system. So let's hear what Jill has to say on her approach of putting patient in the center and creating the support from caregivers as well as us clinicians.
Hi, this is Sabrina Runbeck, where I vibe with Jill Michaels, with Keith and Kim. So please share with us, what's the big mission behind your company? And then what's that unique problem you guys are solving in the healthcare space?
Absolutely. Well, kith and kin's an old-fashioned term for friends and family because we know that there's no one way that people care for the people they care about. Our work is, and our entire mission is to help people better care for the people they care about by offering them tools that allow them to really share information, but primarily share the load, right? We all know that caregivers bear the physical and emotional burden of caregiving, but kind of that silent, painstaking effort they do to manage the administrative burden as well is one of the biggest challenges they face, and it really goes unseen.
Yes, definitely from both the clinician side, the caregiver side, and the individual side, that admin. Remember all your appointments, all the paperwork, where do you need to show up, how do you get there, all that back end. It's not even the care itself. It's sorting through the noise and the things to actually get you somewhere.
Absolutely. We have so many patient portals, right? And we have so much to kind of vomit data on you, but people are like, look, I manage humans in a very human way, and I'm going to manage symptoms, notes, questions, reactions, reminders, all the things that happen every day. And they happen in my living room. They happen in my community. They're not happening in the four walls of a care setting. And that's really the role of the person we call the kin keeper. That's that person playing air traffic control for all the appointments and reminders, central intelligence, making sure everybody knows what they need to know when they need to know it. And they're exhausted. They're frustrated. And oftentimes caregiving can be incredibly isolating.
Exactly. That isolation side, we know, has a lot to do with the detriment of their own health, to feel that even you can be with a whole room full of people, but you're not being understood. You're just alone in the journey that you have. So explain a little bit for us exactly what the platform do for your caregivers and patients.
Yeah. So it's a collaborative health information management solution that really helps you get to the human side of this, right? Because we spent over 1,000 hours in user research before we wrote a single line of code just talking to people, right? And big surprise, they don't want to fill out forms. They don't want data vomited on them. They take pictures, make notes, store documents, make contact. They nag the crap out of people to do things for them, to try to get the things done that they need to get done every day. So what we built is a solution that mirrors life, right? That allows you to take a picture, make a note, store a document, but have all of that information all in one place and allow you to share some information with some people and other information with other people the way you do in real life.
Yes, we know, especially for elder population, they're not going to remember to type things into a digit or the app. So definitely, even for myself, is handwritten things, take a picture so I remember. Otherwise, that piece of paper is going to get so lost.
Yeah.
So that being said, how are you able to bring the solution to the market so the users truly can understand and be able to get to their hand?
Yeah, well, absolutely. So we've been in market for the last year. We have our first 5,000 or so users. And now we are launching our mobile app on March 5th. So native mobile app for iPhone and Android. So we're a direct-to-consumer solution, but we're also going to market in partnership with organizations that will be kind of B2B2C solutions. At our core, we have to be a portable, human-centered solution in order for this to be impactful and valuable to the end user. But we're working with all kinds of partnerships, from anything from folks working with children with special needs and chronic conditions to adult children managing aging parents, and even veterans and military families.
Yes, thank you for carrying both the young and the military people who protect us. And really, truly, it's about partnership. No matter is your B2B2C versus B2C, it's how do you create that synergy with the people that you're doing business with. And it can be so mass, right? And then to stand out uniquely is definitely a challenge. So if I give you a magic wand, something you can just instantly disappear to help you truly move forward with your business, what's that one thing?
That one thing would be patient access to actual health records. And for the individual access mandate that's kind of been in federal legislation for the last couple of years to truly be both enacted and enforced. Because while I don't believe that data and electronic medical records is the solution to the very human problem, the ability to quickly access some key medical information would go a long way to being able to help people have a true and full picture of their health and be really an effective advocate for the people they're caring for and about.
right? So it's both from you guys that are able to get the hands on the right information so you can help these end users to source things out and truly move forward.
Yep.
Now, we love conferences, and that's why we're at Vive. And so what really excited you about coming to Vive, and what do you really want to get out of it?
Yeah. Well, so, Vive and health and all these conferences have a very different, I'll call them vibe about them, right? It feels connected and personal. I don't, and so what's been really great about this is you're able to set up meetings with folks beforehand. You're able to really be engaged with people in a very personal way here that I think you often don't get at a lot of other conferences. So for me, it is that connectedness. It's meeting people who could be kind of a part of the journey, because look, at the end of the day, we're a part of a larger solution. This has to be an ecosystem. This is not going to be one single point solution that's going to solve the very human problem of caregiving. And so for me, it's all about partnerships, and, I'm here to find them.
Awesome. How can people find you the best way, or your solutions?
Yeah. So we're at kithandkin.app, and we will be March 5th. We will be in the App Store under KinKeeper. And so we're just really excited for people to try it and really believe that we can help.
Thank you so much for being here, Jill.
Thanks for having me.
All right, everyone, are you fired up from hearing these two ladies presenting their solution? We're definitely be missing big pieces of puzzle in the healthcare arena. But what about the unsung heroes? What about how we search for information and directly giving us the right resources, trust it, and link to those experts right away? Now, these folks are like air traffic controllers of healthcare system, juggling appointments, meds. And if you think about it, even for some of us who are quote unquote healthy, when we need medical attention, and even for me, who's been in the healthcare system for many years, even for me to schedule an appointment, understand the payment plan for surgery, understand things that from an admin billing perspective, even though I'm in surgery myself, but providing a care to billing the process and delivery is so convoluted and complicated. And sometimes it does feel like it's a mountain of work that we have to really get to. So we really need to create the Swiss Army knife of healthcare solution for our caregivers and our patients, and really creating that simplified resource. And it's not just about making life a little bit easier, it's actually optimize every single way of being and doing, not wasting time on boring things and things just actually feel like we need to pull our hair out, but actually the things that really truly matter to us is getting to the solution that we need. So we would love to hear from all of you, your thoughts, and post that on LinkedIn, tag me, Sabrina Runbeck. Let us hear about what have you found as very helpful solution in the caregiving and patient care space that you believe can be the next best thing, or even now has been working super well. And tell us, what do you see as a collaborative healthcare information management system that can truly enhance our patient care or caregiver support?
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.